For the second half of this panel, we're going to talk about, go to the other end of my bubble scale, you remember? We're going to talk about patients who are acutely ill, and we've got a couple of different approaches here of how that might play out. So first up, I'm going to introduce Todd Johnson. Todd Johnson is CEO of HealthLoop. He's been there since 2012. Many of you know that Jordan Schlein, who's been at HealthLoop many times, funded that. What Todd is going to show us is that HealthLoop is an automated patient engagement solution that engages patients at scale. To be clear, it's used for patients who have been in the hospital, have had an acute episode, are sick, and are being followed up with in a way that probably just didn't exist before. And in the conversation, you'll get through. Do have to put one disclaimer, although I'm an idiot because I didn't realize this. I'd invited Darren and I invited Todd to talk. I didn't realize that Darren is on Todd's board, so it's not a quid pro quo. They're here randomly because I didn't figure that out. Perhaps I should talk to each other. Do a bit more. Anyway, Todd,
that just
ready to go?
Stakes if I screw up.
It does a bit.
So first of all, I'm with Dave. I think there's 300 million Americans that want better quality at lower costs, and they're willing to contribute time and energy to do it. Should I go ahead and get started?
Yeah, please dive in.
First off, raise hands. Who watched the debate on Monday night?
Everyone was here in the room. No one watched it.
Anyone watch?
All right, I'm noting you guys all down, not being at our session.
So words matter, and if you listened really carefully to what Hillary had to say, she tipped her hand on part of her agenda to fix healthcare. She said, "We live in a world of trumped-up transitions of care." Did everyone hear that? Yes. So why do we exist? Today, hope is the strategy for healthcare. When we discharge patients after they were in the hospital, after a new diagnosis, we do what we can to educate them. We hope that they do well, but nobody knows how they're progressing. HealthLoop follows up with patients on an often daily basis, engaging them directly with their physician team to guide them through what to expect, give them the right information at the right time, and identify the needle in the haystack, the patient that needs help. So I'm going to show you briefly a patient interaction on HealthLoop. I'm going to show an orthopedic case study. We have programs across all surgical specialties, as well as high-cost chronic disease management, diabetic care, congestive heart failure, et cetera. This is a patient that's going to be coming into the hospital in 2 days. She just received a push notification from her doctor. Empathy matters, caring matters, what her doctor is saying, and actually Howard Lux uses this on many of his patients, as does Cedars-Sinai. Right? Your procedure is just 2 days away. We are here for you. We want you to get the best outcome possible. Don't forget, clean up your house. We don't want you tripping and falling and being part of the 0.7% of orthopedic cases that end up back in the ER or needing an additional surgery because you failed. Right? You may be surprised to learn that home is the safest place for you to be, and we're going to partner with you to get you there and carefully monitor your progress. Right? We start educating patients around post-discharge issues before they're under anesthesia. These are the things that you can look out for after discharge. Don't worry, we're going to follow up with you and educate you on what you can do to help prevent adverse events. Because of this, with over 300,000 patient interactions a month, we know that the HealthLoop patient has 35% fewer blood clots than the non-HealthLoop patient. Right? Now we're going to do a quick assessment to find out, do you have any clinical indications that are going to actually increase your risk for a bad outcome? If so, we may want to defer. Right? Patients can always access all these resources, but part of the HealthLoop model is you can't improve what you can't measure. And so in this case, we're measuring patient-reported outcomes from before an admission, but to years after, say, a spine surgery. Right? And so what we know is that patients are willing to engage. 74% of push notifications are opened 12 months after I was discharged from the hospital. Patients are always invited to review all their information online, everything we've sent. Think about this as all your health educational materials in your pocket. Can we switch over to the web for just a second? So now I'm going to switch gears and look at this from the professional's eyes. We know doctors, nurses, care management have no more time to do anything else, but they're now under a mandate to get better outcomes. Right? So HealthLoop surveys every patient every day, again, 300,000 a month, and identifies the needle in the haystack so our care management teams can be extremely efficient at targeting resources on the patients that need it right now. We also continuously measure patient satisfaction. I think the statistic I'm most proud of at HealthLoop is 91% of patients say they are thrilled. And yes, older patients and sicker patients use technology to engage. It's silly to think that they wouldn't. And lastly, continuously monitoring not only patient outcomes, functional outcomes, but cost metrics that are hidden away in this health plan, that health plan, or this EMR. Guess what? Patients know that data too. So we collect that data and provide it to our customers so that they can improve their performance.
Thanks, Todd. Can you come grab a seat behind us?